whether you've been looking at things individually or for your business, I'm sure you've experienced the price increases, the extreme price increases the last few years in healthcare. And bad news, it's going to keep going up. So, a question that we see a lot of times with businesses, especially smaller businesses, is can I provide healthcare benefits for my employees? And yes, you can, but probably not in a traditional way. One of the things that came out of the ACA, the Affordable Care Act, was there is no such thing as major medical plans anymore. Everything is full service, and it obviously makes that more expensive, and it continues to go up. So the cost for a business is, for a lot of folks, unattainable. The strategy that a lot of businesses have taken over a few years is increasing deductibles, increasing out-of-pocket, but the ACA also set limits on those, and a lot of businesses have hit that. So the last variable is employee contribution. And as that goes up, what we've seen with a lot of businesses is as they're putting more of that contribution onto the employee, employees stop participating in their healthcare plan and they end up asking, why do I even have this? I've got 4 people on my plan. The other question is, why should I provide benefits? And there's a lot of good reasons for it. One, recruiting. If your competitor is offering benefits and you aren't, that's a differentiator. Retention. People a lot of times don't want to leave their job whenever they know they have benefits. That's what's really retaining them. And then something that really kind of applies with how we do things is you can increase your employees' compensation at a discount. So for my practice, for a corporate membership, it runs between $80 to $100, depending on company size, but we'll say $80. If you take that and divide it out to what an hourly rate increase would be, it's 45 cents. So is 45 cents an hour going to mean much to an employee? Probably not. But unlimited clinic visits, a doctor they don't pay for 45 cents an hour, you've actually given them something and it didn't cost you nearly what you would have to do to gain the same loyalty by increasing salary. There's 2 ways that we have to kind of look at it. So are there any companies that have more than 50 employees currently? Well, I know Ned wants to get all of you there, but I'll speak real briefly about that, and that's a magic number. So 50 employees or greater is what is called an ALE, and for those, they are legally required to provide benefits to employees. And we work with some of those companies, Ford, Bacon and Davis, Vivint Inc., Patient Plus, Moral Physical Therapy, Dynamic Group. What we do with those guys is we move them into a partially self-funded plan. I have strategic partners who come in, and it's really a turnkey approach that we come in and completely change the plan over. When you're on a partially self-funded plan, you are basically the insurer. Now, we say partially because there is a stop loss, so there's a maximum exposure. But the idea being is if your plan spend is less than expected, that's your money, the company's money. If you have Blue Cross and your spend is less, that's Blue Cross's money, and they're never even going to tell you about it. So it's a great way to go for that larger company if they're self-insured. What do? We help manage the plan and we control claim costs just by being efficient. A phrase I like to use is good medicine is cheap and bad medicine is extremely expensive. And so we just try to practice good medicine. So for the majority of folks who are non-ALE, how do we go about it? Well, one approach is not doing anything, and that's what a lot of folks do that are in that smaller group. They don't feel they can provide benefits, so they just don't. We have a few approaches that we've used successfully with companies. One is they just provide our clinic services. So it's between $80 and $100 a month, and what that gains the employees is when they see us, there's no charge. One of the things that I think is really nice for both the employee and for the employer is we don't have patients come in for just simple routine things to clinic. I'll share a dirty secret in medicine is unless you have a face-to-face encounter with a patient, you can't submit a bill to insurance. That's an absolute rule. So that's why doctors always say, I need to see you. Does he really need to see you to look in your ear? No. But that's how you're paid. They're not doing anything wrong. When I worked in that system, I did the same thing. But I'm no longer bound by that. That's not how I'm paid. So if somebody has a UTI, we treat it. We have secure messaging. So people typically just send us a message and we manage it. So easy for the employee, reduces your lost time. They're not gone for half the day sitting in a waiting room instead of at their desk. So that's the other things that we provide is I have a license to dispense my own medication in clinic. So when I write a prescription, we fill it right there, and it's wholesale price. We contract for labs, annual labs. I'm sure you've experienced this. The standard annual labs run about $300 to $400 through insurance. Our cost is under $20. And then we directly contract with imaging, and with some subspecialists, they bill us outside of insurance. A $2,200 MRI is about $400. So for the folks that do the standalone service, the company is paying either all or a portion of that $80 to $100 fee, and most of them leave those other costs to the employee. But they're helping to buy them that significant discount that they wouldn't have otherwise. The expanded coverage goes into, I'm doing primary care, I'm handling the routine stuff, but it turns out I can't take out a gallbladder in my office. So what about surgeries, malignancy, pregnancy, hospitalizations? When they're doing it as a standalone, they're leaving that to the employee of you should get a policy of some type. But even with the exchange, with the subsidies going away, it's gotten very expensive. And those have always been not the best plans. So we partner with a company that's called Zion Health Share. They're different than the typical health shares that you hear on the radio. They're not faith-based, so there's not pledges. They do allow smokers and some of the other things that the other companies don't. But what really differentiates them is they have true major medical. So they're only covering those big ticket items. They don't cover routine office visits. They don't cover labs. They don't cover routine medications. We can do that cheaper than they can. And what about OB, you're going to see a cardiologist. Going to see someone and paying cash is almost always cheaper in the end. When you're in a fee-for-service based practice, your bill is much higher because you have to account for all the overhead that goes with just trying to get paid. So if you're getting paid up front, it's going to be cheaper. So that's what we tell people for those things, just pay cash. And then lastly, and it really is not a big jump, but the broker that we work with for our larger companies, he's graciously offered to help us. When folks are wanting to do a full package, then he's adding on the voluntary vision, the voluntary life, and all that good stuff. That doesn't cost the employer anything. It's optional. What does it really gain? It gives you the slick folder so you look like everybody else. So when you're doing recruiting, you have the nice presentation just like a large company that's paying Blue Cross does. So the biggest challenge that we have in direct primary care when we have national meetings is no one believes us. They're like, there's a catch, there's a trick, there's something, and there's not. It's not so much that this model is so much better, it's that the current model is terrible. So these are numbers, and this is real. This is right off of Blue Cross's website. And taking in the assumptions of it's a 40-year-old couple that goes to the doctor twice a year, 2 urgent care visits, and is on 1 to 2 medications each. So their monthly premium, $1,640. deductible at 12.2, and their max out of pocket at 16.6. So their premium is coming out annually to $19,680, which is a stunning figure. Their expected annual cost, that's taking the amounts they're paying when they go to the doctor, just basic costs. This is, again, Blue Cross's data. I think they're being a little conservative, but I'm going to use their numbers anyway. So they're saying, about another $3,000 coming out of your pocket. And then maximum exposure. That's your fixed cost plus all the way up to what your max out of pocket is. So if you have a really bad year, you're at $36,000. The other thing that's not on here is, and a lot of people don't know this, with commercial insurance, there's a cap. There's a point at which insurance says, we have paid our part of this, and you are on your own. When you see the little jars at the convenience store to give to a family, that's what that is. So there is a limit that you can hit. In comparison, taking that couple, using our clinic, it's for the two of them, $185 a month. A plan for them through Zion is $222, and their max out of pocket is $15,000. So it's a little complicated, and it's certainly something I can talk through where we come up with that max out of pocket, because it is a different approach than just pure deductible, but it makes a lot of sense when we go through it. So the fixed cost for this option, just under $5,000. I was liberal on the expected annual cost, because really they're very low with us. It's medication, labs, and like we talked about, those are pretty cheap, but I threw in a little bit just to be fair. So you're looking at expected of $5,000 versus $23,000. And your maximum exposure is your fixed cost plus the max out of pocket, which puts you at $20,000. So this is real. Most people have not heard of it. Nationally, it's massive. On the West Coast, Northeast, it's just blowing and going. Just in Louisiana, we're slow adopters. And for businesses that are providing benefits, I hate to tell you, but your broker may or may not be the friend that you think he is. They generally hate this. And the reason is there's no fees in this. They get paid a lot of bonuses, a lot of money to keep people on those bloated commercial plans. An engineering firm we had a few years ago, their broker had told them for over 5 years that they should not self-insure, they would lose money. And their first year was a 2.1 year-over-year savings, and they maintained that average for the 3 years we had them. And I don't think the owner and the broker were such good friends after that. So talk to somebody independent, talk to us. We love to help small businesses, even when it doesn't end up being in our clinic. Getting you to something that's smart and that's affordable and that helps your employees is what truly makes us happy. We'll be around afterwards for questions. We have T-shirts if anybody wants them. They're a hot item. Thank you for your attention.